I literally found what I was meant to do. I've always loved children. It was just a really long route to get to where I am now. My name is Heather. I'm the area clinical director for Northeast Florida. I manage all of the clinical directors. Each business unit has a clinical director or an assistant clinical director, and I work one-on-one with them to help manage all of the nurses in the field. It's 24/7. The nurses are working day and night, so there's a lot of assistance that's needed. I actually have been in healthcare for about 20 years. I worked in the hospital for 1 year and realized that I absolutely hated it. For me, being a nurse is really making a difference in someone's life, and I felt like just seeing them for a couple minutes here and there throughout their stay in the hospital and then just shipping them out the door. I never got that connection. It wasn't there. It was just, there was that big piece that was missing. And then I had a friend that had told me about home health. And I thought, wow, I never knew about home health. It's not something that they teach you about in nursing school. So I just, on a whim, decided to take a job in home health. I started with adults because, again, I didn't even know that pediatric home health was a thing. When I moved to Florida about 6 years ago, I was approached by a recruiter that was for pediatric home care. They reached out to me online and I was like, wow, this is really intriguing. I never knew about pediatric home health. I love what I do every day. It's really one of those things where a lot of people wake up and they don't like their job, or they don't like what they're doing, or they don't feel like they have a purpose. I wake up every day and I'm excited to do my job. It really gives me purpose in life. There is a lot of communication that goes with my job. So we are all in different areas of the state. So it's a lot of communication. We do different meetings throughout the day where I might meet with the operations side of the business, and then I'll meet with the clinical side of business. We do a lot of educating our nurses that come in that are brand new. Maybe they've come from hospital nursing and they've never experienced working with a trach or a vent or even a G-tube. So we do a lot of hands-on education for the nurses, so assisting the clinical directors with that. We do meeting new clients, so we do a lot of meet and greets. So when babies come home from the hospital, or maybe children have a new diagnosis, we'll go out to their home, meet them, learn about their family, and then see how we can care for them. So the hiring process is very unique to Care Options for Kids. Everyone sort of comes in with a different background, whether they've only done adult nursing or they have pediatric experience, but maybe they've never had experience working with a trach or a vent, or maybe that's something that they don't want to do. They want to start with something a little bit less acute and then work their way up. So we will work with any nurse, depending on what her goals are. If she wants to start with an easier, less acute patient and then get her hands wet and work with them for a little while, and then she decides she wants to move up and work with a trach or a vent, we will bring her in for hands-on training. We'll get her in another home with a preceptor so she can learn, and then they can do as little or as much as they want. If you're kind and you're compassionate and you're truly a people person and you love working with children and you love getting to know your families and you're looking to really make a difference and a connection with a family and with a child, we need you. We are looking for nurses all of the time. Just realize that there are other options outside of, hospital and facility nursing. If you're looking for more flexibility in your schedule, that was one thing that was really important to me when I moved from hospital to home health, was the flexibility. You're not required to work holidays. You're not required to work weekends. You are able to make your own schedule. So if you have children at home, it's the perfect fit for working your schedule in with your home schedule as well.